Hi, everyone, and welcome to our podcast series for September Childhood Cancer Awareness Month. We're interviewing families and patients who have gone through childhood cancer. Our guest today is Elena Bliss, mother of Brittney. To start off, could you tell us about Brittney?
Hi, yeah, thanks for having me talk about Brittany. So, Brittany is my daughter. She was diagnosed with embryonal rhabdomyosarcoma in May of 2022 at just 4 years old. She was prior to that this happy, healthy little girl who love to dress up and, perform shows in our kitchen by dancing and singing. And there was really, nothing as far as like a precursor that we were going to be facing childhood cancer ever. Um, so Brittany, what happened was she was battling what was believed to be an ear infection. She went and saw her pediatrician multiple times. They said it was an ear infection, and then we started noticing some facial drooping on the right side of her face, and that's what prompted us to take her to the emergency room. And they thought it was maybe Bell's palsy. So they did some imaging and they thought it was just a really bad ear infection, and they were going to admit us and put us on IV antibiotics. So then the head of ENT decided to get more imaging. They felt like they had clipped some of the sinuses in that area. So thankfully, they sent her back for more imaging, and that's when they noticed this kind of mass. And then they sent her for an MRI. And then we were being told that we were being shipped off to Boston Children's Hospital because they believed that she had what was called Langerhans cell histocytosis. Um, so we ended up taking an ambulance to Boston Children's. We get admitted there. We meet with every department as far as neurology, infectious disease, and basically everybody goes through and gives their differential. And at the end of the day, they're like, it's just a really bad ear infection. And we're going to take her to the OR. We're going to put tubes in her ear to drain the infection, and we're going to send you home. And so you talk about a roller coaster of emotions where you're thinking your child's being diagnosed with cancer to it's just a really bad ear infection and you're going home. So we kind of breathed a sigh of relief. We wheel her down to the OR, and they come out and they said, we've changed our mind. We're going to go in and do a biopsy. We don't think that this is just an ear infection. And our hearts just dropped. Like, how could we be on these opposite ends of the spectrum? And so after the biopsy, we had to wait a few days, and sure enough, they came back and said it's this embryonal rhabdomyosarcoma that is located in the petrous apex of her right temporal bone. And it was parameningeal, so just outside the meninges of the brain. And so that was just the most devastating thing um, that I think I could ever experience in my life is my child being diagnosed with cancer. Um, so then we moved forward with treatment. She had to get a port placed in her tiny little body at 4 years old. We were also having conversations about preserving one of her ovaries. We had to make the decision if our child ever wanted to have kids of her own in the future. And so we had one of her ovaries preserved so that we could give her that choice to make. Because of the chemos that were going to be used, they were going to cause her to be sterile and not be able to have kids of her own. So at 4 years old, she started chemotherapy, and then we eventually moved to 30 rounds of proton radiation. And that involved us moving out to Boston for about 6 weeks to have her be sedated every single day for the radiation treatment. Um, at the end of radiation, we were still on chemo. She was really improving, like her facial features were coming back, her voice was coming back because she had some vocal paralysis. The tumor was kind of pressing on some of those nerves on the right side. And so we were just chugging along. We thought, okay, we're doing everything we're supposed to. We're kind of, we're seeing response out of her physically. Everything's looking great. And basically, the beginning of December, she went in for her routine MRI to just check post-radiation. And that's when we got the next big blow was that her cancer had spread on active treatment, and it had actually spread to the meninges around her brain and started coating her spinal canal. And so they basically informed us that that is what is called leptomeningeal disease. and there is no proven treatment for it because they like to use the term just like they do in childhood cancer. It's very rare. It happens in about like 1% of cases. And so it being on active treatment was even more startling. Um, so then we entered into another battle of just trying to find anybody across the country that would give us a bit of hope. This was December of 2022, about 2 weeks before Christmas. Uh, so we scoured the country, we contacted multiple rhabdo specialists, and thankfully we connected with a doctor at Connecticut Children's who was willing to try anything to give us that bit of hope that we needed. Um, so we started different chemotherapies. Unfortunately, they weren't successful. They also caused more harm than they did good as far as she suffered neurotoxicity, which was kind of mistaken for seizures. She had to be put on methylene blue, which is this like blue medication that can help kind of reverse those side effects. Um, and then basically her disease just continued to progress no matter what we threw at it. And in June 6th of 2023 is when she passed away at the age of 5.
I'm really
Yeah,
sorry.
me too.
Is there anything you would have done differently?
Gosh, is that a question that I play in my head all the time? Um, it was one of those things where when you're in the moment and you feel like you're doing everything and everything's going well, you feel confident in your decisions. And it's one of the hard things as a parent when your child is diagnosed with cancer is making decisions with very little information. The doctors will present you with the options, and obviously the final decision comes down to you. And so you're being thrust into these situations that are very intense and very heavy. A lot of things weigh on what you do or don't do. The one thing I wish that maybe I could have done differently is finding CCTDI after Brittney passed and learning about the research that they're doing and how Dr. Charles can also, work with people that are on active treatment too, as far as just providing like different insight or knowledge. That's one thing I wish that I had knew prior, as far as just another resource to kind of help educate myself because again, as parents, when our children are diagnosed, we become caregivers, our own doctors, nurses. We're researching everything on the internet, trying to save their lives. And sometimes having that other resource probably would have been beneficial. It may not have changed anything, but um,
Maybe it
it's
would
hard.
have helped you have a bit more knowledge about what was happening.
Yeah, I mean, it's again, you're thrust into this world, and if you don't have an understanding of medical terms or even where to begin, it's very overwhelming. And you're also trying to care for your child, and you want your focus to be on them, so you can't spend 6 hours a day online trying to research stuff. So it's hard to juggle everything as a childhood cancer parent.
Yeah. So, what is Brittany's Believers and its mission?
So Brittney's Believers is a nonprofit that we started, and it all came about from when Brittney was going through her cancer journey. We wholeheartedly believed that this was just going to be a chapter in her life and that we wanted to give back to all of the people and foundations that supported us during her journey, as far as helping with finances and just being able to support those other families, saying, like, okay, we've been through it and we know what you're going through, and we're here to help as a resource. Um, when Brittney passed, we decided that we still wanted to do that. We still wanted to honor the mission that we had set out to do, even though we didn't get what we wanted as far as Brittney being cured of cancer. But then we added into that part is supporting research. And that came about because the more we lived in that cancer world, we were really hit in the face with how little research is funded and supported. And a lot of the funding comes from families that have either gone through it or have a story of somebody close to them that have gone through it and raising funds through like walks and lemonade stands. But when you are being told that in 2022 and 2023 that there's a lack of research and that there's not treatments, like that's unacceptable. Um, so we decided to carry on Brittney's legacy by starting Brittney's Believers, and we all of the money that we raise through an event that we host every year called Bands for Brittney. Half of the money goes to research, and the other half goes to supporting families in the local area as far as providing like financial assistance or giving back to the hospitals where Brittney was treated at.
That's really great.
Thanks.
What do you think are the next steps and how will you and your family continue honoring Brittney?
It's a great question. It's one of the things that we want to just make sure that we're being true to her. She had such a love for music and she loved to dance. And so we just want to continue sharing her story, being a resource for families in need because each and every day we're seeing more kids diagnosed. And it's not just because you're in that world. You know, a lot of times people say like, oh, once you're in the childhood cancer world, you're more aware of it. That's not the case. The statistics are staggering as far as how many kids are being diagnosed a day um, in our country and across the world. And so we just want to continue to support research. We hope that we can just continue to do that on a bigger level as far as raising more funds. We are also starting to get into advocacy as far as really raising awareness about like different bills that are trying to be passed in not just the state of Massachusetts, but on the federal level as well. And really just trying to draw attention to the people that may not be aware of what's really going on, right? Before Brittney was diagnosed, I knew childhood cancer existed. I heard the commercials for like St. Jude's and I knew it was out there, but it was kind of this far away thing that I really never ever thought would impact my life as far as especially my family or even somebody I know. And now it's like there's, two other kids in our town that are diagnosed. There's been like so many in neighboring towns that are being diagnosed. And so it's really something that can't be ignored anymore. And we need to stop using the term that it's rare because it's really not. And so if we can just, take Brittney's Believers to share Brittney's story, raise more awareness so that we can get more funding, so that we can find a cure and even better treatments than the ones that we're still using from 30, 40 years ago. I mean, that would just, it's never going to bring Brittney back, but it would help a little bit in the process of, just knowing that something in her name is being done. Something good's going to come out of this.
Yeah, I think the work you're doing is amazing.
Thank you.
That's kind of the end of our questions, but do you have anything else you'd like to share?
I mean, I could talk about Brittney forever. I mean, she was only 4. She was super excited she was really looking forward to start kindergarten. Unfortunately, she never got to do that. She loved to dress up. Like her favorite movies at the time were like Encanto, and she would dress up as Isabella. And she loved watching The Grinch, but it was had to be like either the scary Grinch, which was the one with Jim Carrey, or like the newer animated one. Um, her favorite color was purple. That's why the foundation color is purple. And then we incorporate the yellow as far as gold for Childhood Cancer Awareness Month. She really was just this incredible little old soul who had incredible comedic timing. She had an energy about her that just kind of drew people in. She wasn't this like outgoing kid, right? She was kind of shy and timid in the beginning, but the more you got to spend time with her, she would really open up and show you this just like incredible personality. And um, even when she was going through treatment, she, at 4 years old, she wanted to know everything that was going to happen at the appointments. Like she wanted to know if they were going to access her port and if, what procedures are being done. She was very like aware of what was happening. And it's incredible how these kids adapt when they are having to go through these treatments. Like we ask so much of them, and I think sometimes we just don't even understand if they comprehend what's happening, and they really do. And I remember when she was first diagnosed, and we were having to give her shots for blood thinners. It was, horrible. Your child is relying on you to provide protection and comfort, and we have to give her like these medications and things. And somebody said they'll adapt, like they kind of get used to it, which is really sad. But it was true, like they do, and they're resilient. And I just credit Brittney for being braver than I would ever be and stronger than I would ever be. And I think all of these kids with childhood cancer are just incredible, incredible warriors and fighters, and the things that they have to go through, grown people can't even do. And they just unfortunately go through it, and sometimes even with a smile, and try to make the most of it. But I am really thankful that we met, connected with CCTDI. As far as childhood cancer research, it was very important for my husband and I to find a place where we knew where our funds that we were raising and donating were being used, and kind of having a little bit of say in that. And I have been blown away with Charles, Dr. Keller, and CCTDI for just their level of transparency and their level of compassion for these families, and just communication as well. Like the way that they are so caring and supportive, and the scientists that come in, and hearing about all these kids, and the fact that they want to do this work. And some of these people are incredibly smart, and that's what we need, is just the not just the knowledge but the passion, as far as knowing that these kids are depending on new discoveries for, like I said, even if it's just better treatments that give them more of a chance of being a kid, and less long-term side effects. You guys at CCTDI are just doing incredible work, and that was one thing that really drew us in. And we continue to just support your mission, because it is so compassionate, and it is so caring, and it's really a labor of love of the work that's being done there.
Yeah, thank you so much.